Broadcasting live from the Business RadioX studios in Sandy Springs, Georgia, it's time for Sandy Springs Business Radio. Now, here's your host.
This episode of Sandy Springs Business Radio is brought to you by Mirability, providing unique IT solutions leveraging cloud, AI, and more to solve business problems. Here's your host, Erik Boemanns.
Thank you for joining us today. I'm happy to be here, and my guest today is Dr. Patricia Kelly Marsh of Ask Me Your MD. And so I wanted to welcome you and thank you for joining us today to talk about yourself and to talk about the business and just to share with everybody some of your thoughts. But maybe just a quick introduction of yourself.
Yes. So I am, as you stated, Dr. Patricia Kelly Marsh. I am a board-certified family medicine physician, the CEO and co-founder of Ask Me Your MD Incorporated, or Amy MD for short. And I'm excited to talk about the solution that we came up with that seems extremely intuitive and very helpful. But the objective is to bring accessibility and affordability to care.
That's great. Yeah. And that's obviously a super important thing in today's world. And so I'm curious, maybe what motivated you to start Amy MD? Should we call it Amy MD?
Yes.
Okay.
Yeah, we should.
Yeah.
We should. So it was actually my co-founder's idea. She came to me and she said, I want to make the world's best doctor chat. And I had been going through something that I'd never gone through in my life. Around that time, 2018, my father was hospitalized. And I've just so happened to stay over at night with him. And what ended up happening was he had an emergency overnight. He was vomiting blood. And when I saw that and I assessed my dad, I was like, okay, he's showing signs of obstruction. And this is a condition that could need emergency surgery. He had just gotten out of ICU. So, of course, I was very concerned. I asked the nurse, please call the doctor. She did so 3 times and the doctor never came. And so it was with my knowledge of knowing who the head internal medicine physician was, called her on her cell phone at 2:37 a.m. because that was the time that I thought something is happening to my father. I don't know which way this is going to go. So I will never forget that time or that day. And she immediately got his care rendered. And I felt like this is the power of the knowledge that we doctors have, that so many people watch their loved ones pass away because they don't know what to do. And so I was like, even though the simple idea of having a doctor chat, having that easy access, giving it to you just like my sister has to me, saying, hey, your niece has strep, and she doesn't have to make an appointment with the pediatrician, doesn't have to waste time calling anybody else. And this is a simple text message. That simple knowledge that we have to render the care in such efficient manners, that's what we wanted to add to the idea of the world's best doctor chat.
Gotcha. No, that's amazing. And I completely can understand that need to have that access to a medical professional, especially to your point, it can be very hard for, if we don't know the head of the department, to get in touch with somebody who can help. And I think myself, I had a similar situation with my father in the hospital, and he spent days there because they were waiting for the right people to come see him. So completely understand.
Yeah.
And of course, the other side of that is often it's not about that I don't know who to call, but I may feel that I can't afford to call them either, right? And I may not be able to afford to go see that doctor. So I think you have an approach there as well. Maybe talk a little bit about the affordability side that you're bringing.
Yeah, so that was extremely important. So I'm from here, College Park, Georgia, born and raised. And it's a middle class, lower class community. Now it's being gentrified. The city's bought up a lot of land around there. The airport has extended its reach, and so they're gentrifying the area. But prior to, in the late 90s and mid 90s, there was a lot of disparities that we saw between the health resources that we could get versus those that I would see when I was bussed up to here, Sandy Springs. So I went to North Springs High School, shout out Spartans. And just seeing the differential was something that I never, left my mind in pursuing my career as a physician. I remember in writing out our objectives, because we would always write out like, what is your why? What's the reason you want to pursue this career? And one was to go back to my community and make sure I am availing myself or my resources and knowledge to them to close those health gaps. And so affordability was one of them, like Sandy Springs, median income versus that of College Park, especially during those times, were quite wide. And so the affordability piece was very important for me to make it a no-brainer. And also to the people that could afford, you're paying every single year. You're paying maybe $50 to $75 more for your health insurance premium. But does your access really change?
Right.
It doesn't. Does the benefits actually expand that from what you were getting the years prior from your health insurance? It doesn't. And so now we have to implement something where we are lowering the barrier for those who are insured or uninsured to not only care, but specialists. That was very, very distinguishing from all of the telemedicine solutions that we saw in the healthcare industry.
Got it. Yeah. And that's why I was curious, because obviously telemedicine has grown, especially because of COVID, but even before that, it was starting to make an appearance. And that is very convenient for the minor things, but also, to your point, there's never a specialist there. So yeah, is that maybe expand a little bit on how you distinguish there?
Yeah. So a lot of the post hospital time with my dad, he needed, infectious disease, cardiology, all of these specialists that had wait times of 2.5 months on average or more. And that's just the norm. But if I called the office and said, hi, I'm Dr. Marsh, I'm the, concierge physician for George Kelly, we need an earlier appointment. Voila. All of a sudden, there is access there. And so this was a part of the platform where we were like, oh, we can actually advocate for the patients to get the care that they need and the access a little bit faster, especially for specialty care. But let's just go beyond that. We have a network of friends that are endocrinologists, radiologists, all of these specialties. Let's let them know what we're doing. And they joined us and they said, yeah, we can give those consultations. We do it to each other. We text each other. Even when we're in the hospital and working in the hospital, we'll text a kidney specialist or nephrologist and we'll be like, hey, this is the kidney function test. And what do you think about this? Or what would you do? And I did that with my dad. I screenshot and took a picture of what they were giving my dad in his hospital stay. And my friend who's infectious disease was like, this is exactly what I choose. And that peace of mind, that is just, it's invaluable. Right. And so that's what we wanted to bring on to increase the value of what you get for $35. You can talk to a GI specialist or a cardiologist about yourself or your loved one. Yeah.
Wow, $35. And so, yeah, I don't think you can see that price. Maybe with a copay, right? For your regular provider, maybe.
Maybe, yeah. Right. These days, average copays, they range from $20 all the way to $120, right, depending on your plan. Yeah.
And never a specialist. So that's the other side.
Yeah.
Right.
Probably no less than $80 for a specialty copay. Yeah.
Yeah. And I know that was something that you wanted to work on, was reducing that overall healthcare cost, right? Because if the reason I'm not getting care is for financial reasons, then obviously my care only gets more expensive later. But so maybe talk a little bit about how you approach that. that cost from the healthcare side, from the patient, from the provider side?
Yeah. So for the patient side, of course, there's the direct lower cost that you can compare to your usual out-of-pocket pay for an in-person visit, say at the urgent care, if you don't have an established primary care provider, or, for those specialists, like it is much, much less of a financial barrier. And then for those who are insured, of course, it's less than your copay.
Right.
And so it's good to run, these questions and concerns and inquiries across to the specialist at a lower cost. And so that direct low cost to the patient, that's one of the ways. The second way is a little bit more subtle. So, to kind of understand the way that the money flows within the healthcare industry, you have to understand the health insurances are the big boss and Medicare. They're the big payers. They're the ones that are, fronting the higher cost of care. And so they will do anything to share those costs or to decrease those costs for their business. And so when we see that when physician groups are submitting medical notes that have all of this documentation to get paid, sometimes the health insurance company, they'll see that document and they'll say, we're not going to pay you for everything that you did. You didn't document X, Y, and Z. It starts to get into the weeds of a kind of back and forth conversation of pay me. No, we're not going to pay you this. And that could go on forever. So what I saw and said was, what if we didn't even have to have that conversation? What if we made this very simple for you, health insurance company? You pay us a subscription, we render the care, and you get to have our specialists access for your members, which then specialty claims, oh my, they're like 2.5 to 3 times that of a normal visit. And so they began to see the value proposition very quickly. And that direct contract, then less money for them processing all of that paperwork, less money for us having to have a company that we pay to send the processing of all of those medical notes. Yep. So an entire billion-dollar industry side to healthcare that drives up cost is now being avoided, and we're having a direct financial conversation with the health insurance. That over time will decrease the amount of care that you see, because now they're paying us directly, not at the regular rate, which is 3 times as much, but they're just giving us that consistent lower subscription for you to have access to us. And so that's also a way that we're decreasing costs within the healthcare industry overall.
Got it. Yeah. And I think that's a great point, because it is such a complicated market that people don't realize that it's me, my doctor, and maybe some health insurance, right? But no, it's never that simple. But it makes me curious. I want to pivot a little bit to Amy MD as a startup, as a, as the company. And so obviously you're a co-founder and you're bringing this to market, but it sounds like at first I thought maybe you had a 2-part market, right? That you had to attract patients and you had to attract providers. But it sounds like it's a 3-way if you're actually going to the insurance as well. Yeah.
We can even call it a 5-way.
Okay. Yeah.
There are so many verticals because physicians and patients are at the core of providing healthcare and rendering healthcare, right? Yeah. So we're the 2 key ingredients. The others that are already, having a group of people together that they want to render this care to, we want to bring them in the conversation just to do exactly what I said, which is to decrease overall cost of care. So we have leveraged just our peer connections. We haven't done any formal recruitment for any of the physicians. This is literally word of mouth. This is me and my co-founder getting out there, telling people about Amy MD as a startup. Our first big break came in 2022, November. I remember I was invited to a dinner that CVS Health was having, and they were starting to want to increase the knowledge of clinical trials within communities of color. And so as people of color, myself and my co-founder, Dr. Sirat Mission, she's South Asian, I'm an African-American female, and we are connected to our communities. And so they saw that and they said, we would want you to come on board and help us to educate the communities that you already service. Absolutely great. So now we get free co-branding with a multi-billion-dollar industry leader. And we began to now be on the face of television and radio and emails that were sent out for CVS Health. And so people began to know our name and associate us with a trusted person within the healthcare industry. And so that was the start. I would say as a startup, that was one of the key pivots to us being really known even to the world of investors and other health tech startups. So then we got invited for collaborations and other partnerships. And then we went into an accelerator and got our pre-seed revenue, and so it was quite the journey over those next 2 years, just building and implementing new technology, and including AI, because everyone needs to think about that and strategically do it. But back to your point, our friends came with us, and that was like we went from 2 physicians to 12 physicians, and then all of a sudden 26, and now we're at 51 doctors that have signed up to render care on AIM-EMD. But it was through those key partnerships that we were able to do that, get our eyes in the community, and become trusted. And now having the conversation with the health insurance companies, with employers and other corporations of medium, small businesses, to let them know you don't have to spin an arm and a leg to give health access to your employees. Right. And so that's another vertical that we work on, and some more to come. But right now, our B2C model, that's rapidly increasing. And then the B2B, the focus is the health insurance companies for now.
Got it. Yeah. And then every one of those adds a complexity, right, to your effort. So.
Oh, yeah.
So doing it times 5, right?
Right.
But at least to your point, you've got some good partners to create that momentum and to get that brand, that co-branding recognition. So
exactly. Yeah.
And you mentioned technology and you mentioned AI. Which one do you want to talk about first? Because I think both of those are interesting as well.
I think both are very interesting. I would just talk about technology and where I see, technology going within the health tech industry, especially for telemedicine. A lot of us have, gotten very used to the video component, of course, sending over videos and pictures and other kind of key evidence that we can utilize in making our health assessments. But that has gotten to the level of where we now need to incorporate AI, because a lot of that data from those pictures and videos, they can be utilized in such a more high value way. So I'm seeing a lot within the healthcare industry in telemedicine where now AI is assessing the photos, or they're assessing the videos, or they're doing, live assessments with very innovative tools. So I've talked to a couple of founders that have utilized AI to assess the back of the throat to make the diagnosis of strep throat, without going in and getting the test. And so that to me is incredible. It's right. It's making that part of healthcare now accessible through just digital realm. So that's pretty phenomenal.
Right. I think you you make a really good point. If people are hearing the word AI, they're probably thinking the chats, the intelligent agents, right, and things like that. But in healthcare, a lot of those AIs are exactly what you just described. They're diagnostics. They're looking at video. They're looking at images, and so it's a totally different world of AI. It is still AI. It's still machine learning.
Correct.
But it's not the one that maybe is popularized. So if I go to a chat window on my doctor's office and start chatting with an AI, should I trust? Right, we're going to have a trust issue of whether I can trust a chat GPT style medical resource, no matter how well trained it is.
Yeah, certainly never by itself. And I get this question a lot because we are a telechat platform and we're text-based. And so even though we're text-based, there is the fear that, okay, you're going to let the machine take over the conversation. So number one, that's like a medical liability that we are not willing to take on. Okay. Yeah. So you're always going to be speaking to a human being doctor. What we chose to do was utilize AI to have the information assessed on the back end to make the conversation easier for our physicians. So number one, it's learning how they speak to patients. Number two, it's bringing in evidence-based information and letting that doctor know, hey, looks like this is a sinus infection based off of the conversation you're having. This is the latest treatment for sinus infections. And two is taking out that bias piece, right? So when I see you or you see me, there are these implicit biases that we can have just from living life in America. And that's normal. It's natural. But when it comes to care rendering, we need to be very mindful of that. And so when we take out the visual cue for those, I would say 85 to 90% of the telechat consultations that are purely telechat, we need to make sure that we're rendering the same care across the board. Yeah.
Right. No, that makes sense. And yeah, I think that it's a good distinction, right? That you are talking to a human because too many of the chat agents now are not, and it's impossible to get to one. And for customer service with with Amazon, that's probably fine. But for healthcare,
not so much. Yeah.
So I'm curious. Obviously, you mentioned $35 earlier, and I believe that's for whether or not you have insurance, right?
Yeah. Whether or not we are not discriminating, although, we are advocating for those who are insured for the health insurance because we're not billing them, to give us away at free cost, and not as a shared cost because we're saving them more money than they're having to pay for you to have access to us.
Yeah. And so if we're thinking about, you mentioned using AI to reduce the bias. You mentioned the kind of that price, whether you're insured or not. How's that helping reach people who may be underserved today with healthcare?
Yeah. So those that, have heard of us, word of mouth is primarily in these times, the way people come on AskMeYourMD.com. That has really changed their lives, their daily lives and thoughts of, okay, I don't have to save up to go to urgent care. I can actually ask my question or get treatment for these things that I'm going through. And so this actually acts as like something that prevents them from having to go to the emergency room with a simple urinary tract infection or, just something that could have been treated as an outpatient. But because number one, they don't know an office that they can easily go to. Number two, again, the cost barrier to urgent care. This has helped give them that access and maintain the level and quality of access of care, with a physician directly, just like they're, again, one of my own family members. Yeah.
Yeah, that's great. So if people listening today do want to find out more, where do they go? How do they find out more about AmyMD?
Yeah, so you go to AskMeYourMD.com, and we have a button that's really top of the line there that lets you chat with a physician. You pay the little $35 fee, and then you come on and you talk to our live doctors, and we get you to what you need. and instruct you on ways that you can even take care of things before you require like prescriptions. And we're coming on December. And so that's when we have caretaker awareness, right? There are a lot of people that are caring for elderly parents or grandparents. And so we want them to also utilize us as like their resource to help guide them, to help let them know, you're doing a good job, or if they have any concerns about, wanting a second opinion, our clinicians can help in that realm too.
Awesome. And so I think as we kind of wrap things up, one of the things that I was curious as a founder in Atlanta, and it's a great thriving community here for startups. But you've been a couple of years in this. You have a 5-way marketplace, so you're making this even more interesting to yourself.
Yeah.
Do you have words of encouragement, words of suggestions to others who are also thinking about starting their own startup similar to yours, or not similar to yours, but could be completely different?
Yeah, I'll tell you, like I tell my medical school students. So I'm an adjunct professor at Morehouse School of Medicine. And on the road to becoming a physician, you're going to run across a lot of hurdles. Just in life, you're going to experience things that maybe be a setback or a very challenging issue that you have to overcome. And so my advice every single time is just 3 words: never give up. Never give up. I think it is worth telling the story about how I say that I was favored to fail because I've had to overcome failure in so many different ways. Even after my undergrad, I didn't have enough money to pay for the MCAT. I had to take a job over the year after undergrad. And so I was already starting 1 year behind, and you see your colleagues and classmates moving on with their lives and, having the white coat ceremony, etc. And I'll get to the business. I just want to go through all of these failures because each was very key in my never give up, like, resilience. And so that monetary barrier, that, again, it stuck with me. Even now, when I'm thinking about my business and business model and how are you really going to give access? If you really wanted to give access, it'd be free, but then there's nothing free. And so, coming up with all of these price models and assessing the situation and saying, okay, I know who holds the gold, and having a very key knowledge of the industry and how the money runs in that industry is very good. But don't give up. I didn't have the money for MCAT. And then after I got into medical school, I didn't have the money to go to the world's most expensive medical school, Temple, at the time. But I never gave up. So I did accrue quite a bit of debt, quite a bit. And then you're going through residency. You're getting paid, for the first time, which I wasn't complaining because I come from very humble background. And so I was still trying to never give up and continue to pay for all of those loans so they wouldn't accrue too much. But before I even graduated medical school, I failed my first attempt at one of my licensing exams. But that was the biggest lesson because I learned how I know how to be prepared for medical license exams, which I'll have to take for the remainder of my career. And I learned that, you really have to be strategic with your time because I was rushing things, trying to keep up with my classmates. And that doesn't work. It doesn't work. So, nevertheless, searching out your resources, right? So I learned to search out my resources throughout residency because financially it was very strained. And so all of the resources that they had, a foundation attached to every single hospital in the United States. So anyone that's dealing with a medical bill or anyone that's having a hard time paying a medical bill, call the foundation that's attached to that hospital. Call the, financial department attached to that because they have a level of forgiveness of which the government has subsidies for them and they get tax credits for that stuff. So there's a solution out there. You might just have to look for it. And in your never give up journey, you might come across those things. And I did. And then when I started the business, I left a high paying job with a corporation here in Georgia, and went to zero, literally went to zero. But that was the conviction of belief that I had in the business itself. And so never give up, even if you have to start from the ground level again, and believe in yourself and know that, there are solutions out there. There are people out there that want to help you. Particularly in the health tech industry, there are people that are focused in that vertical, in that, that industry. And so seek out who's ever really, really on fire for your objectives and your business model. And then, from going from zero to now, we're like $180,000 in revenue. In the 3 years, we just celebrated 3 years, November 9th. And we're about to raise our seed round. And of course, there will be challenges. Of course. That's a whole long road. But the resilience that has developed along the path of my life, I can't do anything but be grateful, and say to my fellow tech industry or startup or people that are just in the ideation phase, just never give up and keep going. Yeah.
Well, yeah, that's awesome advice, and I appreciate that. And so, thank you, Dr. Marsh, for joining us today. I appreciate you sharing about Amy MD and what you're doing to kind of change the perspective on healthcare and the cost. So, again, thank you.
Thank you for having me.
Absolutely.